No scientific research is 100% accurate, 100% correct. There is always error in any study, any type of study. The thing is that how much error is there and how much error is acceptable. How much error we can accept. So today I like to talk about type 1 and type 2 error in research studies. Generally alpha is set at 5% level, right? In majority of studies they preset alpha at 5%, so they are willing to accept that 5% error is there. 95% this has proved that this drug works, this drug is better than conventional treatment, but 5% chance is still that drug does not work, that drug is no different from the conventional treatment. That has previously or that was formally described in that study, that we accept 5% type 1 error. So there is chance that there is 5% chance that this has occurred just by chance. Like when you flip a coin, there is chance that it might come head or tail. So there is 5% chance that this positive association of this drug has occurred by random chance, and this is acceptable. And the principal investigator decides that how much error is acceptable, and based on that he chooses sample size, right? So sometimes they go more than 5%, like 8%, 10%. Like 10% error is acceptable, but generally I am telling you, most of the scientific studies they accept 5% alpha. So there is 5% chance that there is no association, there is no effect of the drug is not better than conventional treatment, but 95% chance that it works, right? So what is type 2 error? Beta error. So this is just converse of type 1 error. So in type 1 error, what they do, they reject the null hypothesis, but in type 2 error they accept the null hypothesis, and they are not just truly rejecting or truly accepting null hypothesis. This is false rejection, false acceptance. So when you falsely accept the null hypothesis that there is no difference, the drug is no different from conventional treatment, even if you have stated that there is chance that their error has occurred, and that is beta error or type 2 error. So you falsely accepted null hypothesis, but error occurred, and that is beta error, right? So there is always, we compare with null hypothesis, either we reject null hypothesis or accept null hypothesis. And what is power of the study? It is 1 minus type 2 error. So type 2 error is 20%, it means power is 80%. So what I told about type 2 error, this is falsely accepting null hypothesis, that there is no difference, this drug is no different from conventional treatment,